Look at your hands right now, not later, right now, before you do anything else. I need you to actually do this. Not because I'm trying to frighten you, but because what I'm about to show you, most doctors will never take the time to explain. And the people who needed to hear it most, many of them never did. I've been a physician for over 15 years, and in that time, I have seen things on people's hands that stopped me completely. Signs that were sitting there quietly for months, sometimes years, while the person went about their life, made plans, assumed everything was fine. If you're over 50, what I'm about to show you could be the most important thing you do today. I don't say that to keep you watching. I say it because I have sat in rooms where someone wished they had known this sooner, and I would rather you hear it now. In a moment, I'm going to walk you through exactly what to look for. But first, you need to understand something. Something that changes how you see your own body. Something that nobody in a 12-minute appointment has ever taken the time to tell you. And it starts with a Tuesday afternoon I will never forget. She came in for a blood pressure check. That was it. Nothing unusual. Margaret was 58 years old, sharp, organized, the kind of patient every doctor appreciates. On time, informed, no complaints. By every standard measure, she was completely healthy. She sat across from me, started talking about her grandchildren, a trip she was planning for the summer, completely ordinary conversation, and then she placed her hands on my desk. I stopped mid-sentence. Something was wrong. I could see it immediately. And Margaret, she had absolutely no idea. She was still talking, still smiling, still planning her trip. Pay attention here, because what I saw on her hands is something that could be on yours right now. But I'm not going to tell you yet. Because if I tell you before you understand everything leading up to it, you might not take it seriously enough. And this is too important to rush. Here's what most people believe about their nails. They're cosmetic. You maintain them. You paint them. You file them between appointments. That's it. But here's the problem. That belief, that completely ordinary, widely accepted belief, is quietly costing people their health. Sometimes far more than that. Your nails are not cosmetic. They are a living record. A continuous real-time signal of everything happening inside your body right now. Every disruption, every deficiency, every silent disease that hasn't shown itself anywhere else yet. It shows up here first, and most people never look. Think about that for a moment. When did you last actually examine your nails? Not glance at them, not check the polish. Really look, one nail at a time, in proper light. If you're over 50, your nails have been keeping a medical record this entire time. Updated daily. Without your awareness, the question is whether you know how to read it. Most people don't, because nobody ever taught them. Until now. Let's start with something that sounds almost too simple to matter. Color. Hold your hand up right now. Look at each nail separately, one at a time. A healthy nail is pink, not bright pink, not pale, not yellowish or grayish or anything in between. A quiet, consistent, steady pink. That color comes from blood, tiny capillaries running just beneath the translucent surface, visible, right there. When that color changes, your body is not being subtle. It is signaling, directly. And most people miss it completely. This is where it starts, and this is the part people ignore. Pale nails. Nails that have shifted from pink toward white, toward something almost paper-like. You may have noticed it gradually. So gradually that you can't pinpoint exactly when it changed. You just know it looks different than it used to. Most people look at pale nails and think dry skin, cold weather, bad lighting. But pale nails are one of the earliest visible signs of anemia, and not always mild anemia. Sometimes critically low hemoglobin. Your body quietly starving for oxygen. Not dramatically, not with obvious pain or warning. Quietly, in ways that feel exactly like getting older. Like tiredness, like absolutely nothing worth mentioning to a doctor. I had a patient named Donald, 67 years old, retired teacher. He came to me after 8 months of fatigue he had completely attributed to age and stress. He had told himself and his family that he was simply slowing down, that this was just what getting older felt like. When he placed his hands on my desk, his nails were the color of paper, not pale, paper. His hemoglobin came back critically low, severe iron deficiency anemia. He had been walking around with it for nearly a year. 8 months of exhaustion that had an answer, a treatable answer, sitting right there at the end of his fingers the entire time. He was quiet for a long moment after I told him. Then he said, "I looked at my hands every single day. I just thought I was getting old." That's not carelessness. That is a failure of information. Nobody told him what to look for. Nobody told him the answer was already visible. Look at your nails right now, not the shape, the color. Is there pink there? True, consistent pink? Or has something shifted? Don't rush past this. But pale nails, that's only the beginning, because now this is important. Yellow nails. You see yellow nails and you reach for antifungal cream. Most people do. And sometimes they're right. But here's where it becomes dangerous. Yellow nails are not always fungal. And treating a systemic problem with topical cream is like painting over a warning light on your dashboard. The light goes away, the problem doesn't. Yellow nails can signal thyroid dysfunction, chronic respiratory disease, and there is a specific condition, remember this because I'm coming back to it, where all 20 nails turn yellow at exactly the same time. Not one, not two, every single nail, fingers and toes simultaneously. That condition has nothing to do with fungus. It is a sign of a systemic failure involving the lymphatic system and the lungs. But pay attention here. If your nails are yellow and thickening and growing more slowly than they used to, that specific combination is different. Completely different from ordinary fungal infection. I'll explain exactly why shortly, but don't skip past it if you recognize that picture. First, look at the base of your thumbnail. Right now, do you see a small white crescent at the very base? That is your lunula. And I can tell you with near certainty that most people watching this have never examined it once. Here's why that matters. In a healthy adult, the lunula is clearly visible on both thumbs, usually on the index fingers, faintly on the middle fingers. It is a direct window into the activity of your nail matrix, the living tissue underneath, producing the nail plate day by day. When that matrix is struggling, when it is undernourished, under stress, compromised in ways that haven't surfaced anywhere else yet, the lunula retreats. It shrinks. It disappears. Quietly, month by month. Most people don't notice this until it's too late to catch what's causing it early. Check yours right now, both thumbs. Is the crescent still there? Has it changed? Now, I want to stop for a moment, because I know what some of you are feeling right now. You're looking more carefully than you ever have. You're noticing things. And part of you wants to close this video and tell yourself everything is fine. I've seen that look across my desk more times than I can count. And here is what I always say. Finding something early is not a reason to panic. It is a reason to act. And the distance between early and late, in what we are about to discuss, is not a small distance. It is not a matter of weeks of treatment versus months of treatment. It is often the entire difference. Stay with me, because we are nowhere near the most critical part yet. Let's talk about texture. And don't tune out here, because what hides in the texture of your nails is not what you expect. Run the tip of your opposite finger slowly across each nail, one at a time. Smooth or ridges? Thin lines running base to tip, longitudinal ridges, are common after 50. The nail matrix becomes slightly less consistent over time. By 70, nearly everyone has some degree of them. Fine parallel lines are usually just aging. But here's what most people miss completely. If those ridges appeared suddenly, if they weren't there a year ago and now clearly are, that is not aging. That is a signal. Pointing toward B vitamin deficiency, inflammatory conditions, or in some cases, early rheumatoid arthritis beginning its quiet attack on the joints directly beside your nail matrix. Most people feel the ridges, assume age, and move on. Don't move on. Ask when they appeared. That question alone can change what happens next. But the horizontal ridges, this is where it changes completely. These are called Bowes lines, and every single one is a scar, not on your skin, inside the nail plate itself, a permanent mark of a moment when your body went through something severe enough that it stopped producing the nail entirely. High fever, major surgery, serious illness, extreme trauma, chemotherapy. The matrix paused. And when it resumed, it left a groove exactly where the pause was. I had a patient named Victor. He came to me about 2 years after recovering from a serious illness. He pointed at lines across several nails that hadn't been there before. When I looked, I counted 3 separate Bowes lines on his index finger alone. 3 pauses, 3 moments when his body had diverted everything away from nail growth and towards survival. He hadn't connected any of them to anything. He assumed they were just something that appeared with age. Here's what I did. I measured the distance of each groove from the base of the nail, divided by the average growth rate, 3 millimeters per month, and I told him almost exactly when each event had occurred. He went very quiet. Then slowly, that's when I had the fever. That's the second surgery. And that one, he paused. That was the week I thought I wasn't going to make it. The nail remembered. Long after he had tried to move forward, the nail had kept the record of every moment his body had fought for survival, silently. Permanently. Look at your nails right now, in good light. Do you see horizontal grooves crossing the full width of any nail? One nail, possibly isolated, multiple nails at the same level. Your body went through something systemic at that moment. Multiple parallel grooves across multiple fingers, more than one of those moments, each one recorded. Now, stop what you're doing, because I need you to do something right now. A test, 30 seconds. Most people have never heard of it, and it may be the single most important 30 seconds in this entire video. Press the nail of your right index finger against the nail of your left index finger, same finger, both hands, nail to nail at the tips. Now look at the gap between the two bases. In a healthy person, a small diamond-shaped opening, a tiny window of light between the two nail bases. That gap is what we expect. That gap is normal. Now, if there is no gap, if the nails press completely flush with no light, no diamond, no space at all, that is called clubbing. And this is where I need you to pay very close attention, because this is where it becomes serious, very serious. Clubbing happens when the soft tissue at the tip of the finger thickens abnormally, when the nail curves excessively downward, when the fingertip itself becomes bulbous and rounded, changed in a way that crept in so gradually you may not have noticed when it started. The conditions directly associated with clubbing in medical literature: lung cancer, pulmonary fibrosis, chronic heart disease, inflammatory bowel disease, liver cirrhosis. Don't miss this. In 35% of cases, 35% when clubbing appears without a known prior cause, the underlying diagnosis is a pulmonary malignancy. Not a rare edge case. One of the most direct, consistent clinical associations I have encountered across 15 years. And yet I have had patients, multiple patients, living with clubbing for years, who were told by someone, sometimes a clinician, that it was just the shape of their nails, just genetics, just age. Do the test right now. Index fingers, nail to nail. Is the diamond there? Check again. Better light if you need it. If the gap is there, breathe. If it is not there, please, do not explain it away. Do not wait until something else tells you to act. Act now. This matters more than you think. Now I need to come back to Margaret, because I've been holding this back deliberately, and it's time. What stopped me the moment she placed her hands on my desk that Tuesday afternoon? It wasn't clubbing. It was something quieter, something that in many ways is even easier to dismiss. She had a stripe, a narrow, dark, vertical line, running from the base of her right index fingernail all the way to the tip. She had noticed it roughly 3 months earlier, mentioned it to a family member, was told it was probably a bruise under the nail, and she had almost not brought it up to me that day. She mentioned it almost as an afterthought, because she had run out of other things to say. That afterthought saved her life. Now, I have to be precise here, because a dark vertical stripe is not automatically cancer. In people with darker skin tones, these stripes can be completely normal. A benign activation of pigment-producing cells, harmless, present for years without changing. But there are specific features that change everything. And this is the part that most people don't know, the part that means the difference between reassurance and emergency referral. Pay attention here. This is where it gets serious. Width. If the stripe is wider than 3 millimeters, wider than a standard pen line, you need evaluation. Not next month, this week. Borders. If the edges are blurry, undefined, bleeding into the surrounding nail rather than cleanly delineated, that changes the picture. Color consistency. If the color shifts within the stripe itself, darker in places, lighter in others, uneven, that matters. And then, the sign that made me refer Margaret that same afternoon, at the base of her nail, just at the edge of the cuticle. A faint shadow of pigment, extending beyond the nail plate, onto the skin itself. Dermatologists call that the Hutchinson sign. When I saw it, I stopped the conversation entirely. Margaret looked at me and asked quietly, "Is it serious?" I told her the truth. I told her I didn't know yet, but I told her we were finding out today, not next week. Today, she was referred that afternoon. Biopsy within 72 hours. Acral lentiginous melanoma, developing specifically beneath the nail plate. Aggressive, frequently caught late, because the stripe looks so easy to explain, because people wait, because nobody told them what to look for. But hers was caught early, because she was there for a blood pressure check, because I looked, because she mentioned the stripe she had almost decided wasn't worth bringing up. Surgery within 2 weeks. She is alive. She is well. She sends me a card every year on the anniversary of that appointment. I'm telling you this because it is real, because the distance between her outcome and a completely different outcome was one ordinary conversation on one ordinary afternoon. Look at your nails right now, every finger, one at a time. Does any nail have a dark vertical stripe you have been explaining away? A stripe you've looked at and told yourself was probably nothing. Wider than 3 millimeters. Get it evaluated this week. Blurred edges, get it evaluated. Uneven color, get it evaluated. And if you see any shadow of pigment on the skin at the base of the nail, any spreading beyond the plate onto the surrounding skin, do not wait. That is the Hutchinson sign, and subungual melanoma caught early is treatable. Caught late, that is a very different conversation, one I have had too many times. Now, something that almost everyone dismisses completely, nail pitting, tiny dents across the surface, like shallow craters scattered across the plate. They don't hurt, they don't bleed. And almost everyone who has them gives them no thought whatsoever. But don't miss this. Nail pitting is one of the earliest clinical signs of psoriasis, and nail pitting can appear years, not months, years, before a single visible skin plaque develops anywhere on your body. Your immune system is already active, already disrupting, already producing changes in the nail matrix that are visible right now, and your skin looks completely normal, your joints feel fine, everything seems fine. But the nail is keeping the record. In clinical practice, the gap between nail findings and skin findings averages 3 to 5 years. 3 to 5 years of immune dysregulation without a diagnosis, without anyone connecting what's already visible. And the same pitting appears in alopecia areata, an autoimmune condition attacking hair follicles that frequently involves the nail matrix simultaneously. Unexplained hair loss anywhere on your body, nail pitting on more than 2 fingers. Those 2 findings together point clearly in one direction. Look at your nails right now. The surface, in good light, not color, texture. Do you see tiny indentations, scattered pits, more than 2 fingers? That is a reason for a conversation. Not alarm, a conversation. But do not skip past it. Now, brittle nails. I know this one seems too common to matter. Almost everyone over 50 deals with some degree of brittleness. Most people accept it, most people manage it, most people assume it's just part of getting older, but here's what most people miss, and this is the part people ignore most consistently. Brittle nails have a primary clinical cause that gets overlooked more than almost anything else I encounter: hypothyroidism. When the thyroid slows, everything slows with it. Cell turnover, metabolic rate, nail production. The keratin fibers forming the nail plate become dry, rigid, compromised. The nail behaves like dried clay, hard on the surface, fracturing under pressure, refusing to grow, and every other symptom of hypothyroidism is equally easy to dismiss. Fatigue, that's age. Weight gain, that's diet. Cold sensitivity, that's getting older. Brittle nails, that's dry weather. Each symptom invisible in isolation, each one explained away. While the underlying cause continues untreated for years, I had a patient named Ruth, early 60s. She had been managing brittle nails for 4 years before she came to me. 4 years of topical treatments, supplements, dietary adjustments. She had done everything right, on the surface. Her thyroid panel told a completely different story. Her TSH was significantly elevated. Her thyroid had been quietly failing for years, years of symptoms, years of solutions aimed at the wrong level. Within 6 months of proper treatment, her nails had transformed completely. She came back to show me, held her hands across the desk. She looked at me and said quietly, 4 years. I spent 4 years thinking this was just who I was now. You do not have to accept that. A missing diagnosis is not the same as an irreversible condition, and a simple blood test can find it. Now, I want to show you something that almost nobody examines. The skin at the base of your nail, the nail fold. That thin strip of skin just below the cuticle. Look at it right now, not the nail, the skin. That strip contains something that most people have never thought about. Tiny capillaries, blood vessels, arranged in uniform loops just beneath the surface. In a healthy person, those loops are regular, ordered, consistent. In people with systemic autoimmune disease, scleroderma, lupus, dermatomyositis, those capillaries change. They dilate abnormally, they distort. Some disappear entirely, and that change can be visible to someone who knows what to look for before standard blood tests become abnormal, before joints are involved, before organs are affected. The nail fold is a window into your microvascular system, sitting on the surface of your hand, right now. Is there any persistent redness at the base of any nail? Any swelling that keeps returning? Any tenderness you've been attributing to something else? Chronic redness and swelling across multiple nail folds. Ask about autoimmune screening, not as panic, as information. Now, the feet. And I need you to stay with me here, because this is where some of the most serious early signals appear, and it is also where people are most likely to stop paying attention. When did you last sit down, in good light, take off your socks, and actually look at each toenail individually? For most people over 50, the honest answer is, not recently enough. The feet are the farthest point from the heart. That is exactly why early vascular disease shows up there first. Poor circulation, insufficient oxygen, early arterial compromise, it all appears on the toenails before it announces itself anywhere else in the body. Toenails that are thickening, yellowing, growing more slowly, distorting, almost always attributed to fungal infection, sometimes correctly, but this is where it becomes dangerous. In anyone over 60 with any history of diabetes, cardiovascular disease, or smoking, these changes deserve vascular assessment, not just antifungal cream, not just management, because a toenail slowly dying can be downstream of an artery slowly narrowing, and an artery slowly narrowing, left unaddressed, does not stay a toenail problem. I had a patient. Retired builder, 71, not someone who came to doctors easily. He had been treating what he called a stubborn fungal infection across 3 toes for nearly 2 years. 2 medications, neither worked. When I examined his feet, the nails weren't just thickened, they were pale. The skin was unusually smooth, hair follicles no longer receiving enough blood flow to maintain growth. And when I pressed on his big toenail and released, the color took far too long to return. It wasn't fungal, it was vascular. Significant peripheral arterial disease, visible on his toenails for 2 full years. While everyone looked for a different explanation, most people don't notice this until it's too late for the easiest interventions. Do this right now. Press firmly on the nail plate of your big toe. Hold for 3 to 5 seconds until it turns white, then release. Watch. Under 2 seconds for the color to return, normal. 2 seconds or more, impaired circulation. Combined with cold feet, pale nails, slow growth, recurring infections, ask your doctor about arterial assessment. Press, count, 1, 2. Did the color come back? Now, let me bring everything together, because I don't want you leaving here with anxiety. I want you leaving with a system, something you will actually use, something that takes 5 minutes once a week and costs nothing. Natural daylight only. It's the only reliable light for accurate color assessment. Remove nail polish completely at least once a month. An opaque coating can hide a process progressing silently underneath. Color first. Pink and consistent. Normal. Pale or white. Possible anemia. Possible liver involvement. Yellow with thickening and slow growth. Vascular or systemic, not just cosmetic. Blue or gray. Oxygen deficit needs evaluation. Dark vertical stripe. Photograph it today. Measure the width. Show your doctor this week. Lunula. Both thumbs. Visible, retreating, surface. Sudden new ridges. When did they appear? Horizontal grooves. Think about when they formed and what your body was going through. Pits on more than 2 fingers. Discuss autoimmune screening. Shamroth test. Index fingers together. Diamond gap present. Nail fold skin. Persistent redness across multiple fingers. Socks off. Toes in good light. Color, thickness, capillary refill on both big toes. 5 minutes. No equipment, no cost. And it can show you things that a rushed appointment sometimes cannot. I'm Dr. Adrian Cole, and before we finish, I want to say something directly. I did not make this video to frighten you. I made it because for 15 years, I have sat with people after a diagnosis that could have been caught earlier. And the most consistent thing I hear in almost every one of those conversations is the same sentence. I noticed something. I just didn't think it was worth mentioning. Margaret almost didn't mention the stripe. Donald explained away 8 months of pale nails as aging. Ruth spent 4 years treating the surface of a problem that had a root. They are all well now. But what they share is not luck. It is one moment, one single moment, when they stopped dismissing what they had already seen. You may have noticed something today. A color that shifted, a stripe you've been explaining away, a shape you've never examined before, a groove you assumed was just age, or perhaps you check everything right now and find nothing concerning at all? You confirm that. You move on. That is also a valuable outcome. Knowing is always better than not knowing. Look at your hands one more time. Really look. Not as something cosmetic, not as something to maintain, as a record, as a signal, as something your body has been quietly showing you, patiently, consistently, for longer than you realize. And if you see something today, something you have been explaining away one more time after another, please, don't explain it away again. Take a photograph. Write down when you first noticed it. Make the appointment. Your nails have been keeping records this entire time. Now you know how to read them.